Dr. Helene Alexanderson.
Thank you, Dr. Thakitku. I'm going to speak a little bit about why exercise is a vital part excuse me, in the treatment of myositis. And as we have been talking earlier about, it's important to distinguish between active inflammation and damage. So in remission, when there is no active inflammation anymore, exercise is actually the only effective treatment to improve physical health as well as psychological well-being. Next. And with this slide, I want to show how the view on exercise in myositis have changed dramatically over the last 30 years. In the 1990s, when I started to study myositis, all textbooks said it's harmful, you shouldn't exercise, you should rest, especially if you have a recent onset or disease or flaring. But since then, more than 40 publications support safety and efficacy of exercise in people with myositis. And today we're actually back. And today we're actually investigating safety and effects of high-intensity interval training in recent onset myositis. So exercise is a cornerstone in the treatment of myositis. Next. So physical activity is any everyday activity producing increasing energy expenditure above resting sitting levels. And next slide will show health enhancing physical activity recommendations. Exercise is a planned physical activity is a planned physical activity with a goal to improve physical fitness. And we can establish an exercise dose by using the fit factors, frequency, intensity, time. And that means the number of weeks or months that you have to continue to start to see an effect and what type of training we are doing. Now, Leslie. Thank you. So these are recommendations from the World Health Organization, which is based on very strong recommendations from literature. And we should all strive to achieve these recommendations for physical activity. And we know that people with myositis often have, from the beginning, an increased risk of cardiovascular disease, type 2 diabetes, cancer, fatigue and pain, and so on. But striving towards these recommendations can give you a lot of very important health benefits that you can see listed on the left. So we should try to be physically active at least 150 minutes on a moderate level. And that means you get your heart rate up, but you are still able to talk. Or do at least 75 minutes of very vigorous intensity activity, which means that you have a very high heart rate, you're not able to talk to anyone. And in combination with this, we need to do strength training twice a week. It's important to minimize the sedentary time. So just standing up from the computer, getting a cup of coffee before you sit down again, that actually has health benefits. And for people with myositis, and as well as for people over 65, it's important to train your balance to reduce the risk of falling. And this might seem as very challenging to reach these goals. I think we all might be struggling, but you can start where you are. And if you just increase a little bit, that will give you health benefits. And it can be a long-term plan on how to be more physically active. Next. This is a home exercise program that has been extensively No. Oh, I'm sorry. Okay. There are studies showing reduced depression and disease activity. So this study looked at 24 weeks of functional strength training in non-IBM myositis. And as you can see to the left, the black line is the exercise group, and they had significantly reduced depression compared to the non-exercising control group. And they also had markedly reduced disease activity in the exercise group compared to the control group. Next. This is a home exercise program that we have developed. So you do these exercises 5 days a week and can combine them with a 20-minute walk. And this program has been extensively evaluated as to safety for people with recent onset active or flaring myositis. And it can improve muscle endurance and quality of life. And importantly, we could see some reduction in bodily pain. And when comparing this program to a randomized, to a non-exercising control group, it showed that those who started training already at time of diagnosis, they had a much higher level of physical activity after 1 and 2 years. And they were also improved in muscle endurance and aerobic capacity in the long-term follow-up compared to the non-exercising control group. Next. This is a program that you can do when your disease is less active, when you don't have so much inflammation. It's training twice a week, mainly biking. You can start on a lower level, but slowly work yourself up to the goal intensity. And next. And here we could see an significant and clinically relevant improvement in aerobic capacity in the exercise group compared to the control group that were a little bit worse after 12 weeks. We also looked at lactate levels. Can you go back? So lactate is a byproduct of energy production when your muscles work hard with little oxygen, and it can make your muscle feel fatigued. So we could see a significant reduction of lactate levels and a more than doubled biking time to exertion compared to before training, and also compared to the control group where you couldn't see any difference. Next. This program also reduced disease activity and fatigue. It increased the number of small blood vessels in the muscle. Genes related to muscle growth and blood vessel growth was upregulated. And this together show that exercise not only improve whole body aerobic capacity, but also muscle aerobic capacity. And genes related to inflammation were downregulated. Next. This is a home exercise program that was developed and evaluated specifically for people with IBM. And it's a 16-week program where the goal frequency is to do it twice a day for 16 weeks. You can start on moderate intensity only once a day and slowly move up to goal frequency. It's important to have frequent telephone follow-up and measure function and strength in between to make sure that this training program is well tolerated. It showed that muscle strength improved also in muscles that are most affected, such as the quadriceps, the thigh muscles, and finger flexors. Patients improved in their ability to stand and walk. And here are some slides that show results from our recent exercise study that we did at Karolinska University Hospital. And we looked at safety and effects of high-intensity interval training in myositis. Next. So the HIT program comprised of 3 sessions per week. The goal intensity was to do 6 30 seconds all-out intervals where you reached at least 85% of the maximal heart rate. And then you have 2 minutes with active rest in between. And then they did strength training. And the control group performed the home exercise program that we have been using. I showed it a couple of earlier slides that we have been using for many years. And next, we could see that this is the exercise group, and they improved 16% in aerobic capacity. So the dotted lines is one patient, and this is the mean value. And 16% is a very large improvement. A 10% improvement is clinically relevant. And that was this statistically significant improvement compared to the control group, who only had a 2% change. We could also see that the HIIT improved in muscle endurance and self-reported physical function and general health compared to the home exercise program. In both groups, there were some signs of reduced disease activity. In the HIIT, reduced the pulmonary disease activity. And there were responders according to the new total improvement score. Overall, there were otherwise no changes in CK levels or pain or fatigue. Next. So in summary, exercise have positive effect on physical capacity, disease activity and inflammation, muscle health, fatigue, and psychological well-being. Exercise should be individually adapted to physical fitness, pain, and fatigue. And this just hit the button many times. These are all the organ systems, or many of the organ systems in your body that are positively affected of exercise. So exercise is medicine.